Sample collection. Topic: Field sampling in outbreaks. At the end of this chapter, the learner should be able to define investigation and steps of approach in case of epidemics, role of the laboratory in field investigations, what samples to be collected, process of sample collection, transportation, and storage, safety measures, and high risk activities. Why do we need to investigate an epidemic? It is primarily to define the magnitude of the epidemic in terms of time, place, and person, to determine conditions and factors responsible for its occurrence, to identify the cause, source of infection, and modes of transmission, to determine measures necessary to control the epidemic, and finally to make recommendations to prevent its further recurrence. Steps of outbreak investigation. Step 1: Verification of diagnosis. By clinical examination of a sample of cases, laboratory investigations are most useful for confirmation of diagnosis wherever applicable. Step 2: Confirmation of existence of an epidemic by comparing disease frequencies during the same period of previous years. Often, no such comparison is required. For example, in common source epidemics like cholera, food poisoning, and hepatitis A. Step 3: Defining the population at risk by obtaining map of the area and counting the population. Step 4: Rapid search for all cases and their characteristics by means of medical surveys and case sheets. Step 5: Data analysis using classical epidemiological parameters like time, place, and person. Step 6: Formulation, testing, and evaluation of hypotheses to prevent further transmission. And finally, step 7: Report preparation, which should be complete and convincing. The microbiology lab has a key role in outbreak investigation. It establishes the identity of the pathogen causing epidemic by isolation of culture for other molecular or rapid tests. It is responsible for preservation of the isolates and also culture of the possible reservoirs, patients, personnel, or the environment. The microbiology lab has a key role in performing the typing of the strains to establish the relatedness between the isolates of the same species. For correct identification of cases and carriers, it is important to have case definitions. Each patient sample or each environmental sample taken should be given a unique identifier number and accompanied by a field data sheet. All specimens taken from that source should be marked with that unique identifier as well as any other numbers needed to identify that particular specimen. This identifier should be used on all documentation concerning the specimen from that source. Specimen tubes should also be marked with information about the type of specimen and the date when it was collected. All specimens must be accompanied by a duly filled case referral form. For correct sample collection, all steps of sample collection are to be followed to avoid inappropriate or inadequate sample. Sample rejection criteria must be applied unless sample is precious, for example, in cadavers. A checklist must be used for the various stages of taking, handling, and shipping specimens. This should be filled in for each batch of specimen and kept for reference. For each type of specimen, two samples should be taken in two separate tubes on each occasion that sampling is undertaken. One sample can be used for immediate analysis, the other retained for reference purpose or retesting. What specimens to be collected from suspect cases varies from case to case as per the guidelines. For upper respiratory tract, example detection of influenza viruses, posterior pharyngeal or throat swabs are currently the highest yield upper respiratory tract specimen for detecting, example H5N1. Nasopharyngeal swabs, nasal swabs with nasal secretion from the anterior turbinate area or nasopharyngeal aspirate are also appropriate specimens. For lower respiratory tract involvement, sputum is the preferred sample. If the patient is intubated, take a tracheal aspirate or collect a sample during bronchoalveolar lavage. Blood for smear can be taken in malaria or filaria. Blood serum for serological testing of dengue, chikungunya. It is of utmost importance that the sample is transported and stored in a correct way. Samples should be transported at the earliest. Triple layer packaging must be done. Appropriate steps have to be followed to avoid any deterioration or contamination of samples. For example, urine samples have to be refrigerated in case more than 4 hours of delay or use of preservatives like boric acid. Storage of specimens is followed as per the specimen and the agent specific guidelines. The packing of specimens and their shipment to external laboratories by air is complex and is governed by national and international regulations and operator variations. Readers are also referred to the WHO document guidance on regulations for the transport of infectious substances. While investigating an outbreak, personal protective equipment should be worn, which should include latex gloves, mask, goggles or a face shield, gown, and head covering. Ensure appropriate safety measures, including hand hygiene, general safety measures, appropriate biomedical waste management, and infection control practices. High risk activities in an outbreak investigation include a post mortem examination of a confirmed or a strongly suspected human case, capture of birds in poultry sheds or on farms, euthanasia of infected or potentially infected birds or other animals, and procedures such as decontamination in an intensive agriculture system should only be conducted in a fully body coverall with easily cleaned waterproof boots, heavy duty rubber gloves, and eye protection. As we come to the end of the topic, you should be able to investigate an outbreak by identifying the appropriate samples to collect. You should be able to understand how to collect, label, package, and transport the samples. Identify key lab investigations for selected syndromes and suspected pathogens. Now, let's go over a few knowledge check questions that are based on what we have learned so far about outbreak investigation. Case study. Your laboratory is isolating Klebsiella pneumoniae with similar antibiotic susceptibility pattern in blood cultures collected from neonatal intensive care unit over a period of 2 weeks. What will be your plan of action? What should be your first step? Option A. Establish a surveillance system. Option B. Alert the neonatal intensive care unit. Option C. Establish the existence of an outbreak. Option D. Send an investigation team to the NICU. The first step in your investigation would be to
How will you
establish
establish the
the
existence
existence
of
of
an
an
outbreak?
outbreak. This is best done and visualized by plotting a graph and seeing an increased clustering of cases around a particular period of time. The infection control team then launched an investigation. However, no effective communication existed between the team members interviewing the NICU team and those in the laboratory who were testing the specimens. As a first step in stopping the outbreak, what should the team have done to identify the patients or the neonates who were part of the outbreak. Option A, verify a diagnosis. Option B, establish a case definition to identify the cases. Option C, communicating the findings to the public. Option D, implement prevention measures. The correct answer is establish a case definition to identify the cases. In speculating that the point source of outbreak could be the contaminated soap in the NICU and poor hand hygiene, the infection control team is implementing what step in the investigation? Option A, verifying a diagnosis. Option B, establishing a case definition to identify the cases. Option C, developing a hypothesis. Option D, implementing prevention measures. The correct answer is the infection control team is developing a hypothesis. A hypothesis is a proposed explanation that is made on the basis of limited evidence as a starting point for further investigation. What is the role of microbiology laboratory in the investigation? Option A, formulation, testing and evaluation of hypothesis. Option B, data analysis. Option C, report preparation. Option D, all of the above. The correct answer is all above. The microbiology laboratory is primarily responsible for formulating, testing, and evaluating the hypothesis. It is also involved in data analysis and report preparation. The findings from the outbreak investigation demonstrated spread of Klebsiella from the contaminated soap case where all health staff contaminated their hands. The infection control team came up with the following policy: use of fresh soaps and not allowing soap sludge to accumulate. Soap sludge can act as a medium for bacteria to proliferate if allowed to stagnate. Preferable use of liquid soap with dispensers to minimize contamination rate. Cleaning the nozzle of the dispenser with alcohol based hand rub from time to time. Use of alcohol based hand rubs. In formulating an infection control policy, the team is implementing preventive and control measures to prevent future outbreaks.